A very warm welcome to Global Healthcast Notes, brought to you by Global Health Press. I am Joe Schmitt, and with me today is Dr. Ankunda Collins. Hello, Collins. How are you doing today?
I'm doing very well, Prof. Joe. I am very delighted to be here.
Very nice to see you. I met you in Siena at the vaccinology course, and our topic today is your experience as a young vaccinologist searching for an appropriate position. So the first question to you is, can you tell us a little bit who you are and what is your professional background?
So thank you very much, Prof. Joe. My profession is about, I started with a diploma in clinical medicine and community health. Then I upgraded to a bachelor's in palliative care science, and then, of course, to the renowned master's in vaccinology course at the University of Siena under the Institute of Global Health. Of course, Siena is one of the best places to be. Good environment and good professors. You learn from the best. So I would really encourage every young scientist to be there at Siena and get an interaction between one of the experts in the field of vaccinology to make sure that they are also changed the way I was changed.
Yeah. That is a great experience, and I can confirm from many students from there that they had number one, they had a good time, and number two, they really got a great education. Now, you went back home to your mother country, to your country, and you had challenges by returning there. And what is the specific challenge? If you go back to Uganda, what happened to you? What was the difficulty?
So after attaining a master's degree in vaccinology and drug development, I had to return back because ideally the intention for the master's and the sponsorship as well was to have a seat in Uganda or low and middle income countries to make sure that we have key opinion leaders as far as vaccinology and drug development or clinical research is concerned. So when I went back, of course, I had to go back to my workplace. The environment wasn't that fertile because one, you have gotten excellent training, you have done your thesis, and you really want to implement because a low and middle income country, of which Uganda is, most of the times we have lack of qualified scientists to run key healthcare delivery systems. So if it is that you have gone back to this facility, that means one, you do not have the infrastructure to actually implement what you have learned over the period of years that you have spent out in the country. Two, there is shortage of funding, of course. If it is that the frontline healthcare delivery is actually lacking funding, then that means that research will not be having funding as well. So I would summarize that one of the things that I would I faced when I came back was the infrastructure to actually implement what I was supposed to, what I had learned, and at the same time the funding maybe to implement the innovation that I got from the training.
So you came back from Siena, you were well trained, and you mentioned that international support is crucial, but it is not enough without local structures. So when you come back, what needs to be in place that you can implement what you learned?
I would really think I would borrow a quote that context-based solutions should be solved by local-based problems should be solved by local scientists. So the context matters a lot as far as however much the program could be the project or the program could be one of the best. However, if it lacks context, then it will face resistance. So that's where the local talent actually comes in. So international organizations could actually play a collaborative role in terms of giving maybe fundings or infrastructure to actually implement local solutions by local people.
Yeah. So what would you recommend specifically for governments locally and institutions to create more opportunities for people like you?
So yes, thank you very much, Prof. Joe, for the question. What I would recommend is that one is the recognition, because you will find that, of course, I would say thanks to COVID, to some extent, vaccines came out there and vaccinologists started coming up, and the community started getting to know the use of vaccinologists. But back to what the question was, one, it is recognition that maybe they could have a ledger or a register that captures maybe who has gone out and for study opportunities, what have they gone to study. So as part of the learning or the soft learning that comes in when they return from the country of training, they can settle them in, give incentives for maybe research, because you realize that research grants that are out there, most of the research grants that are out there need maybe 10 years of experience in research. So that means that you would have eliminated this young scientist who is enthusiastic, really got their, they tried out something that they would think that it would make a difference. But right now, of course, it is going to a waste, because they are doing the same things that they used to do in the way they used to do them, while before even they had not gone out. So yeah. One is source of funding. Two is a landing that the health system can absorb them and make use of them.
Yeah. So with regard to research grants, there is a bias against young investigators, right? You have a hard time getting the grants, and for various reasons. What can be done? What do you think? What can be done to change the situation so that you have an opportunity to, start your career by nice research grants?
I would. Thank you very much. I would say that one of the things that can be done and is doable is maybe mentorships or fellowships. So international organizations work throughout the whole globe. So that means that they can give local mentorship, whether virtual or on-site. That is one of the approaches that can actually work. Two is giving incentives, maybe putting out there early career researchers program to make sure that they have access to funding, they have access to infrastructure, they have access to support that they need to make sure that the programs are implemented or research is implemented the way it is supposed to, with the resources that are locally in there.
In our article on your situation when you returned, you mentioned that pharmaceutical companies are very reluctant to conduct clinical studies in low-middle income countries. What do you think? How can this be improved? How can pharmaceutical companies change the situation?
So I would say, in my perspective, this is two-sided. One is about the country itself, in this context, Uganda. And the other perspective is about the pharmaceutical company. So I will start with our side as Ugandans, as the government of Uganda. I would think that maybe they could give incentives to make sure that they attract in terms of maybe the bureaucracy that is there in regulatory pathways, to make sure that they, not that they should ease them to reduce the quality, but there could be a way to make sure that these companies are attracted to actually carry out clinical trials, research or clinical trials in country. So as part of that, it would be as well, we could on the government side, the recipient government side, it would be better if there is also an incentive that, if it is, I wouldn't call it an incentive, maybe if it is that the company that is going to market their drugs or their vaccines in the country, there should be a local maybe scientist to monitor that, so that the context comes in. So that is on the side of the government. And then the side of the pharmaceutical companies, one of the things that they should realize is that, of course, carrying a clinical trial in Uganda is not so much more expensive than maybe carrying out there. So they should come in, and at the same time, so they should partner with institutions like the University of Siena to make sure that they know where their graduates have come from and where they could implement research, and at the same time give incentives to those graduates to make sure that we have a well-trained scientist who has come from the University of Siena or wherever, and then they come to the country to make sure that one, their clinical trial is of quality and acceptable standards, but at the same time run by a qualified vaccinologist or clinical trial specialist.
Let's come back again to what we discussed first. And I think despite excellent training, people like you and well-trained people are forced to take their old jobs, and they cannot change anything. They cannot apply and implement what they learned. What would be your insights? How can you leverage your new skills to have an impact with your new knowledge and all the things that you learned? How can you be more effective in your country?
So one of the things that maybe like I should say, this environment where you find that you do not have, you actually do not have the infrastructure or the support that you need. One of the things that you should be innovative to look for a way to integrate whatever your job was to actually fit what your training could be. So one of the things that I have done, or any other person can do, is to make sure that maybe you integrate research in the positions that you have been in, and at the same time also the institution that you are working with, recognizing that maybe right now you have another qualification, or you have another skill set that is there, to look for a way to support you through small grants that can be issued to you to implement research in order to step up the game as far as even the research arena is concerned.
Yeah. So from what I hear, the situation is that several or some or many, I don't know, researchers returning from trainings abroad, and they are frustrated and they leave again. So the training that was intended to support their own countries was successful, but it has no benefit for the country. So what do you think, what would be the benefit, or what do we have to tell governments in low middle income countries why they should support returners from training programs?
I really think one of the things that the governments should know is that a skill one is paid for. So if it is that you are not incentivizing the skill that one has learned, then they will be taken out, and you will not benefit from what from the skill set that this scientist has actually attained. So I really think one of the things that we should tell them is we should have a register. And I emphasize that we should have a register where we register who has gone out for what has he gone to study. That is one. Two, how can we make sure that we retain this participant, we retain this scientist? So the government, it might not be that the grants that the government can give might not be that big, but there can be a side pocket, I should call it a side pocket, where they can give incentives to these young scientists who would wish to actually stay in their own countries and then impact on the healthcare system delivery and of course the research arena as well. So two things, they should know that it comes at a price, a skill comes at a price, and at the same time, we should look for a way to retain them, to make sure that we up our game in terms of health services delivery and clinical research as well.
Yeah. Now, we've looked at what your governments and what your institutions in Uganda or low middle income countries can do. Let's think a moment. What do you think what international organizations, academic institutions, governments, pharmaceutical companies in the Western world, what can they do to help change your situation, to make sure you are implementing what you learned in your country?
I have touched it a little bit, but I think I will re-emphasize it as well. I think collaborations, partnerships, is one of the ways that international companies can support these young scientists or this government to actually utilize this highly trained clinician or physician or scientist. So collaboration in terms of if they would want to implement a clinical trial, this would be the best time to approach the government. Who do you have as maybe a vaccinologist? We would need vaccinologists maybe who are 2-3 years down after qualification to work with them, implement projects, then we cater. We can start, actually they can start as, of course I know the value of money, we should know that. We can start with a pilot project. How does this young scientist work? Can he or she implement a project that can impact lives? Yes. So $10,000 US, $5,000 US can be like a seed to test and see whether there is a change. After that, then probably bigger projects could come in. Yeah. So I think that is one way, but through partnerships and collaboration with the government and the international companies, or with the international companies and these young scientists through their institution as well. That could be one way to link with them. Thank you very much.
Collins, thank you very much for your insights. Thank you very much for writing the paper with me. We'll put it to the show notes. I think this was our Global Healthcast Notes today. Today is October 23rd, 2023. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
All right, I'm Collins Ankunda. I thank you very much for paying attention to this. We will be grateful if you liked, shared, and for reach, so that the concerned parties could know about this. Maybe something could be done. Thank you very much. Bye-bye.
Bye-bye.